Dear friends, good evening to all. I am Dr. Arun, consultant gastroenterologist and hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai. Today I would like to show you all an interesting case scenario in a man who just completed 40 years of age who presented to us in the background of persistent abdominal pain for a duration of almost around 10 days. And for this kind of presentation, the patient underwent treatment elsewhere outside and the patient's symptoms been worsening, and for that even the patient referred to us for further management. And when we did a clinical examination, we can able to identify a prominent jaundice along with a persistent pain in his upper abdomen. Why I would like to point out this picture, once the patient is going to develop jaundice is nothing but if you are going to develop your yellowishness in your eyes, along with if the patient is going to land up with any evidence of high colored urine, you need to report to the gastroenterologist as early as possible. And to this patient we can able to identify a prominent stone in his bile duct. If the patient is going to have evidence of jaundice, it could be because of any infection or it could be because of any obstruction which is going to happen. This patient been developed a obstructive pathology because of stones which happened in his gallbladder for long-standing duration, and he didn't underwent treatment for that, and this patient turned out to be a prominent stone in the bile duct. Bile duct is nothing but your bile drainage tube. Once the patient is going to develop this kind of presentation, you may develop cholangitis. The patient may have fever, worsening of jaundice, severe abdominal pain. So we need to do an emergency ERCP procedure to retrieve the stone out. So you can able to identify a black colored one which came out is nothing but a prominent stone from the bile duct. Why I would like to point out, this is an emergency presentation. So much of pus been drained out. So unless if you're not going to relieve this, the patient may have worsening of events. Thanking you all for patient listening.